Hello everyone. The topic which will be covered today is epidemiology of dental caries. So dental caries is the most common dental disease around the world and is primarily caused by tooth loss through young adulthood by the age of 35 years. The average person has lost 5 teeth and has 11 more attacked by caries. So coming on to the definitions. So the study of distribution and determinants of health related states in specified population and the application of the study to control the health problems. It's called dental caries. Schaefer's in 1993 has defined dental caries as an irreversible microbial disease of the calcified tissue of the teeth characterized by demineralization of the teeth, characterized by demineralization of the inorganic part of the and destruction of the organic substance of the tooth, which often leads to cavitation. Here are the stages of caries development. So you can see the first picture, it shows that how when the caries are only related to the enamel surface, it is still a pinpoint or a occlusal surface caries. Then later, if it's not treated at an early stage, it reaches the dentine. Then it later infects the pulp, causing pulpitis, and eventually a periodontitis occurs involving the periodontal ligaments. So coming on to the gaze triad, that shows that dental caries occurs. So this figure shows that once all the three teeth are three factors come into contact, only then caries occur. This shows that all the three factors are interrelated. So here's another picture showing that the important factors are host, agent, and environment. So the host, agent, and environment are the principal factors for causation of disease. It's a very important topic, frequently asked in the board examinations also. Then comes the host factors. The host factors are the factors which are responsible for dental caries formation. First is the morphological characteristics. It shows that the presence of deep, narrow occlusal fissures of buccal and lingual pits, alteration of tooth structure by disturbances, and formation of organ calcification. Then comes the tooth position. Teeth which are malaligned, rotated, or out of position may be difficult to clean and tend to favor the accumulation of food and debris, eventually causing dental caries. Next comes the saliva. So the saliva also plays a very important role. So the fact that teeth are in constant contact with and bathed in saliva would suggest that this factor could profoundly influence the state of oral health of a person. Then comes the age. Age is another important factor where it shows that previously caries was considered essentially a disease of childhood, but it shows that three peaks ages of dental caries are there, which is 4 to 8 years, 11 to 19 years, and 55 to 65 years. The next comes the gender. The gender shows that many studies have shown that higher caries experience in girls than boys are being noted and showed in a later period. And due to hormonal changes, also, females tend to have dental caries before than males. Next comes the race. So, non-European races such as African and Asian enjoyed freedom from caries than Europeans. Moreover, certain groups once thought to be resident to caries became susceptible when they moved area with different cultural and dietary patterns. Next comes emotional disturbances. Definitely, periods of stress have been associated with high caries incidences. So, shows that schizophrenics have reduced caries activity, which may be attributed to increased salivation and higher pH of saliva. Next comes the nutritional socioeconomic status, which shows that it is difficult to correlate caries pattern with socioeconomic status due to complexities. Low socioeconomic status group people have more number of decayed and missing teeth, but less number of filled teeth, and vice versa in high socioeconomic status. So next comes the agent factors. The agent factor shows that caries occur due to microflora microorganisms. So all the microbial factors which are responsible for caries activities are Streptococcus mutans, Lactobacilli, and actinomyces. Then comes the diet also. Diet also plays a very important role. The next is the Stevens curve, which shows the experiment was done to study the changes occurring in the pH of the plaque of after glucose intake. And Stephen was one of the scientists who performed this experiment on groups of patients with different caries, decayed activities ranging from caries resistant patient to caries susceptible patient. The Stephen curve is a graph which shows that what happens after sugar is consumed in relation to caries. The graph explains that the more time in the day in the mouth is hit with sugar, the worse it is your teeth. So you can appreciate how it shows that how the graph of the pH of saliva falls a minute after sucrose falls before the sucrose is consumed, and the minute after sucrose rinses are done, the pH of the plaque and saliva just goes high. So here it shows the table that how there's a change from remineralization to demineralization in 10 to 20 minutes. Next comes the environmental factors. So the environmental factors that are the factors which are responsible for occurrence of in dental caries, geographic variations, which includes latitude, distance from seacoast. So definitely the latitude increases, sunshine decreases, and this will reduce the amount of vitamin D formed. This leads to hypoplasia of the teeth. Then the distance from the seacoast, caries prevalence is maximum at seacoast. In sunshine, ultraviolet light from the sun is known for its ability to promote synthesis of vitamin D in skin tissues, thus reduce caries intermittency. Temperature varies with latitude and altitude. Then comes the humidity, which shows a higher correlation with caries prevalence. Then the rainfall, which leaches minerals from soil and blocks sunlight. So humidity are linked to dental caries prevalence. Next is higher fluoride content in soil and groundwater, lesser the caries. So, and then comes next is the total water hardness, which shows that water hardness is measured by the concentration of calcium carbonate, and inverse relation is seen between caries and water hardness. Then coming on to the Indian scenario, so it shows that definitely the studies have been done which has showed that uh, India has been the prime place which comes under developing countries, which shows that the number of caries are reported here in children and as well as in adults. And WHO has also reported a DMFT score of 3.94 for India. The data from the National Oral Health Survey from the year 2002 to 2003 states that children aged 12 years, the caries prevalence was 53.8% and mean DMFT was 1.8%. According to the Global Burden of Disease study, dental caries is one of the most prevalent and preventable non-communicable disease worldwide, with an estimated 2.5 billion people affected by dental caries. So here we can conclude that if dental caries remains a major health issue in the worldwide, and particularly among vulnerable groups, namely women and people with a lower socioeconomic status. So given the high proportion of untreated caries lesions amongst young adults, preventive approaches such as regular screening and provision of interim of conservative restorative techniques are highly recommended in early years of life. So, with this, we come to the end of this lecture. Thank you.